organizations struggling to try to balance the current crisis with all those things that don't go away.
So to quantify it, it has been an intense struggle and burden for several reasons. When the pandemic first hit in the spring, the reality was that, especially when it went into the goal of trying to put stay-at-home orders in place, several things suffered. We saw automatically that there was a significant reduction in childhood immunizations because children weren't able to go to the doctor's offices. Parents weren't able to take them; they had to stay at home to that extent. So automatically, while we were concerned about the COVID crisis in that regard, we also recognized that there are other things that were unintended consequences. The ability for folks to really address, proper food and nutrition. Oftentimes in this country, there's certain segments of the population where their food or their means of nutrition is tied to their educational exposure. So they go to school to get proper meals because of whatever situation they have at home. So now you're not in school, now you're in a home environment. How are you ensuring that the nutritional value is really being provided to those at-risk populations? Similarly, when it comes to addressing prevention, like health and welfare, the food insecurity issues, all of these things essentially get very strained. On top of that, several of the staff members were pulled off of the work that they normally do to address COVID. So there was a significant shift in the staffing capacity and their ability to fill in, as we would say, to cover for things that aren't being done. And when you started to see the run on focusing on getting contact tracing and case investigation, that really added much more folks that needed to be hired, needed to be addressed, while at the same time shifting those resources. And one of the other unique aspects of this, which has really been one of our biggest problems through this entire pandemic, is that we saw a shift in the culture and the societal understanding of public health, especially with respect to the attacks against science. So oftentimes we would say the health authorities are oftentimes the unsung heroes. No one knows them. They're there working on stuff. I mean, I can tell you hundreds of outbreaks that I've helped either track, trace, or address, and no one would be none the wiser. But with respect to at least in the U.S. Side of the coin, with respect to the anti-science stance and some of the politicization that we saw, oftentimes many of our members, many of these same folks who are stressed, they're trying to address the community needs, they're trying to get PPE, they've shifted their roles to focus on COVID, then they got targeted. We've had people whose lives were threatened with death threats, who's been physically, harmed, who've been, attacked on social media, people showed up inside their homes. We've had over close to 100 local health department officials who've simply been fired, retired, or got pushed out because of concerns about their following the science in that regard. So that burden on top of the exasperation of doing the response, you can understand why I quantified it as saying or qualified it as saying an intense burden and stress.